Hey, Nurse Adina here. I'm actually going to use some notes today and talk rather fast to hit the 3-minute mark. So today's talk, I want to speak directly to people with cancer who are actively going through treatment. Hopefully TikTok does not take this down because this is some important information that I think we need to start talking about, and it's not always discussed at oncology appointments. So today I want to talk about the link between cannabis use and fungal infections. I get that cancer patients sometimes use cannabis for nausea, anxiety, pain, lack of appetite. Your doctor understands that too. But natural is not always better. The marijuana industry is not regulated. Okay, so marijuana is notorious for carrying mold spores, which is a fungus. And when smoked, those mold spores get inhaled directly into your lungs. And mold loves to live in a warm, wet environment, which is exactly what the bases of our lungs do. They provide that warm, wet environment. Now, for the average person, our immune system could probably handle that abuse. But for cancer patients going through treatment, they are frequently immunocompromised, which means big fancy word saying they don't have a robust immune system and they're at risk for infection. I've taken care of patients who've been going through treatment who insisted on smoking pot and developed a fungal infection. It's heartbreaking. Fungal infections are not bacterial infections. They are extremely difficult to get rid of. They can be drug resistant and they can be life-threatening. So in 2020, the CDC reported on a 2016 study that showed that cannabis patients were 3.5 times more likely to develop a fungal infection compared to those that did not. And it's not just the government that's aware of this problem. Our marijuana growers know it too. So Leaf Nation wrote an article about the issue and acknowledged the problem in January of this year, 2021. As you can tell, cancer patients are near and dear to my heart. I know that this is exactly what God created me to do, to take care of cancer patients. And that's the last thing they need is one more thing added into their profile. Okay, so with a fungal infection comes medications, and more medication side effects. Common symptoms of a fungal infection would include a dry cough and shortness of breath early on. Could later lead to chest pain, fevers, and chills. I won't get into too much of the signs and symptoms today. So for your own safety, please, please, please do not smoke it. And remember, lastly, follow the science. We can find whatever we want to hear on the internet these days. If you would like to continue the conversation, I'd be happy to talk to you. Please find me at nurseadina.com. Hope you guys are having a great day. Thanks. Bye.